Hi, welcome. This video is all about the pelvic floor in menopause. Shifting estrogen affects the entire body, including the pelvic floor, and it can cause or worsen a number of very uncomfortable issues. This topic doesn't get a lot of attention, so I think it's important to talk about how low estrogen affects the pelvic floor, what symptoms and discomforts these changes can cause, and what treatments are available to help you. So let's get to it. Estrogen is necessary for proper collagen production in the body, including in the pelvic floor, maintaining the health of vaginal tissue, the urethra, and bladder muscle function, and for proper blood flow to all of the tissues in that area. When menopause causes a drop in estrogen, tissues begin to thin out and the support structures holding the pelvic organs weaken. This can cause a shift in the natural position of those pelvic organs like the vagina, urethra, bladder, and bowel, and cause a number of issues and discomforts. The first of those problems is incontinence. Many women experience leaking in varying degrees when coughing, sneezing, laughing, exercising, or having a full bladder. It's actually quite common, but still very frustrating and upsetting, and makes leaving the house a real challenge for many women. Weak pelvic floor muscles with or without vaginal atrophy can cause frequent urination and recurrent UTIs as well. So if you're dealing with either, it's important to be assessed for atrophy and pelvic floor issues and potentially be prepared to have to address both. Next is a prolapse, which is a displacement of an organ from its normal position, usually downward. The initial stages of a pelvic organ prolapse often begin with the stresses in childbirth, but become much more evident in menopause when the pelvic floor weakens and organs sag or drop further. This can be very distressing and greatly affect quality of life. I truly feel for any of you dealing with prolapses. Pain with intercourse is also common and can be the result of a weak pelvic floor, a prolapse, or vaginal atrophy. So pinpointing the exact cause of the problem is very important to adequately treat the discomfort. Constipation can be a problem if there's any degree of prolapse in the back wall of the vagina. Of course, constipation is a very common symptom in perimenopause and postmenopause for several other much less serious reasons. So please don't panic if constipation is on your list of symptoms. Next is a heavy feeling or the sensation of something in the vagina in the case of a prolapse. With more severe prolapses, it's also possible to actually see tissue on the outside of the vagina or feel something very low down in that area. Fecal incontinence can also occur with a weak pelvic floor. Loss of stool can occur with a strong urge to use the washroom after a bowel movement or with activity and is very upsetting and disturbing. And rightly so. Low back pain can occur as well, although this particular problem can also have many other causes. So if this is your only symptom, some investigations beyond the pelvic floor are important. Everything on that list is horrible, and I'm sorry if you're having to deal with any of it. There are some things that you can do to help strengthen your pelvic floor muscles and help ease some of the problems in that area. Let's talk about those. The first thing I think is important to deal with is vaginal atrophy because it's often a contributing factor. Using vaginal estrogen or other treatments to improve atrophy and alleviate related symptoms will help you more easily identify those issues that are being caused by pelvic floor problems. Next, there are actually pelvic floor therapists out there that provide physical therapy for that specific area. They help to retrain and recondition the pelvic floor muscles to help improve their overall strength and functionality. It's a reasonable option if you need more help than lifestyle and at-home exercises can provide. I'd be very interested in hearing from any of you ladies that have done this type of therapy. Did you find it helpful? I hear it's a very valuable treatment option, but I don't have any personal experience with it. Pelvic floor exercises can be done at home and do help strengthen the muscles in that area and ameliorate frequent urination and incontinence. The most famous of them are Kegels, which I'm sure many of you are well acquainted with. They require you to tighten the pelvic floor muscles and then relax them. You can identify the proper muscles by stopping and restarting your urine midstream. Once you have a good grasp on how to do Kegels properly, do them a few times a day. Squats and bridges are also very good choices. Avoiding bladder irritants like caffeine and alcohol, not over drinking fluids during the day, and bladder training are all useful for bladder discomfort, frequent urination, and incontinence. Bladder training involves voiding at preset times and doing your best to hold your urine as close to those times as possible, then increasing the interval between bathroom breaks. It doesn't sound like a very pleasant experience to me, but if it actually helps, I suppose it's worth it. Maintaining a healthy weight also helps by decreasing the pressure on the internal organs and pelvic floor. It's also important for health for a list of other reasons as well, so do your best. In the case of severe pelvic floor dysfunction and advanced prolapses, surgery may be necessary. The type of surgery required varies depending on the type and degree of prolapse. Many of us notice loss of muscle in our arms, legs, and other body parts, but we don't often consider the pelvic floor. They're not muscles we think about frequently, but they can cause some very uncomfortable and serious problems. So restoring strength in that area is important. Share your experiences in the comments if you like. I'm always happy to hear from you and learn from those experiences. I wish you all health, happiness, and peace of body and mind, and I will see you all in the next video. Bye for now.